Richard Branson asking for $7.4 billion to bail out the airline industry, principally his company. The same man who sued the NHS. I think what should happen is the government should simply move in and take over the controlling stake at minimum cost or no cost. The Virgin Care should be immediately requisitioned into the National Health Service. He should become a pariah in British and global society for being someone who's profiteered out of the National Health Service and now at a moment of need is asking for more money for his airline business. We should not be paying to rent beds at £2.4 million a day from the private sector to relieve the pressure on the NHS. That should be requisitioned from them. The government has the power to do that. If it lacks any particular power, Parliament can pass the primary legislation within 24 hours. In fact, with the private hospitals, they ought to be being shamed, not paid. They should be being shamed for not having, a month ago, already volunteered any capacity they have to the National Health Service in the interests of the public health of everybody in Britain. The coronavirus has cast a light on every single aspect of our society. The economic relations, the class inequalities, migration, capitalism, big pharma, everything is seen in a new light and we have to respond to that. I think it can lead to great empathy with people around the world and an urgency to act, and to act in a way which knows no borders. The virus knows no borders. Our solidarity should know no borders. We'll see the best of humanity and we'll see the worst of the behaviour which is encouraged by the capitalist system. We have to base our response, I believe, as a society on building up the best side, both because it leads to practical measures and effective steps now against the virus, but also that it poses the question of an alternative. To give an example, the Health Secretary, Matt Hancock, he said Britain has a high level of engineering skill. We want anyone who has the manufacturing capacity to shift to producing ventilators and oxygen tents and so on. Now, if you think about that, this is a Tory government saying something which has been a propaganda point from the left for decades. Stop making F-16 fighters, make kidney machines and medical equipment. Now that, I'm sure, is not where the government wants to go, but they've opened the door to that, something seriously to fight for. That in the next 6 weeks, 8 weeks, we will need many, many more ventilators than we have in Britain. The lead-in time means that that shift has to take place now. There are many, many examples in Britain as to why we can't rely on the government in times of emergency, flooding in parts of the country, the tragedy, the atrocity that happened at Grenfell Tower. Where the government steps back, we step in. We need the community's cohesion and solidarity, but we need also to take control of the big resources, the big concentrations of capital. Because the problem is, you can have great empathy and solidarity in a neighbourhood, but if you haven't got the material resources, you've not got a lot to work with. So we need to marry the two together. The way that capitalism works is that a tiny number of people have control over the means of making wealth and the means of sustaining health, and they only allow those to be used by us if they can make a profit out of it. If they cannot make a profit out of it, they blackmail us, browbeat us, do not allow us to use the resources. That is essentially what capitalism is. At this moment, we need to move in the opposite direction. I don't know which is worse to contemplate. Is it that they can think quite calmly about killing lots of people and maybe that having some economic benefit? In the Telegraph newspaper, one journalist thinking out loud about how if lots of older people died, then we wouldn't have a social care problem. Or whether what's worse is that they would prefer to save lives, want to save lives, but that their own structure and ideology means that they're incapable of doing it. I'm not sure which is worse, deliberately killing lots of people or being bound by an ideology and a capitalist structure which necessitates the deaths of lots of people. But either way, we have to challenge what it is that they're doing and the underlying logic of it. We'll have to see what happens. It's not going to go back to normal. How much capitalist normality is restored, to some extent, is down to us. It's down to how much can we move in a radically different direction in the course of the practical, extraordinary measures to meet the crisis now. If we can do that, I think we can have a ratchet effect. We can have created some new normalities, some new normalcy about what we expect in the society and how we behave in the society. If we can do that, then tragic as this is, it will be something which perhaps can help us move to the place we need to be. The hope comes from people coming together, a couple running a corner shop in Scotland, distributing coronavirus packs of hand sanitizer, hygiene products and masks to everybody in the village who's vulnerable. If you're worried about going out to the shops, if you're in one of the very, very vulnerable groups, there will be people who want to do that. I've got friends who are self-isolating in a very vulnerable category who've been contacted by complete strangers to say that they'll go to the shop. There are more ordinary people with common decency, more of us than there are the likes of Richard Branson. I'd really urge you to support Double Down News on Patreon. Times like this, things are going to move very, very rapidly. We need news sources that we can trust, news sources which are going out to get the stories and amplify the voices which are often suppressed in the mainstream media. Double Down News is different. Please support them.